with me Dr. Clare Szalay TIMBO, and I would introduce her as she's a technical advisor for gender and special projects Orbis Canada. She's got a 15 years rich experience in public health, focusing on a lot of things and a lot to do with expertise in designing, managing, and implementing health programs across health development, emergency response, and hospital settings. So, very privileged to hear her having a strong background in gender equality. Very interesting to know about social inclusion and innovative health solutions. She has an experience in research as a close to her heart kind of scenario. And she's in advocacy, and she's great in fundraising and knowledge management for sustainable evidence-based programs. Skilled in training and facilitation, delivering workshops in diverse audience, and we heard her yesterday as well. So she's rich in whatever she does. I would want her to speak on this topic, which is she's going to tell us a little bit more about redefining success in ophthalmology, women eye health leaders.
Arti, another moderator,
Yes.
Dr. Carmen Chan. Just after her, you introduce,
Sure.
and she will also moderate with you.
Very much. Can I have 3 sentences of your intro? I'll just speak formally also. I'll read it out.
Maybe later. Maybe should we, without further ado, do you want to start the talk first? And then
Jimbo, we can
Yeah.
have you.
Okay. Thank you all so much for having me here. It's a pleasure to be in India again. I'm originally from Seattle, Washington, so it's a joy to be here with you this morning. Thank you for that kind introduction. I wanted to share that when I was growing up, my dad was a leadership coach, and he taught us from a very young age that everyone has the capability and unique qualities to be a leader. So when we talk about
You have
redefining
another
success in ophthalmology, where I come from is this idea that we all have the opportunities to be a leader in our own ways, and we all get to show up in the way that we do that
We have
every day.
lunch on Monday.
So even when I was a little kid, I would show up in a different way than my brothers, but I always felt inherently that as a leader, I could make change with different groups I was working with or even within my own home. So that's sort of the foundation of what I believe in. And I also
Which
look
is the
around
first
and
speaker?
see leaders across this whole hall. So I just want to frame where we're at right now with gender equity when it comes to women who provide healthcare, right? We know this is a common phrase that women deliver health across the globe, but men are still leading it. And this is a paradigm that must change. There's also unique challenges that impact females versus males in the work setting. So workplace violence is very common. There's higher attrition rates when women choose to have a family versus their male colleagues. And then we also know that there's different types of barriers when it comes to retention, and trying to figure out exactly how to support female eye health professionals looks different than when you just do it for everyone. Specifically in ophthalmology, we know that women are on the rise in terms of our numbers of trainees, but we are still seeing the underrepresentation of women in leadership roles. We also see that there's still a pay gap in many settings between female and male ophthalmologists, as well as disparities in leadership when it comes to society, executive leadership roles, as well as in the academic world. So I am so pleased to share that due to these unique barriers, a group of women a number of years ago came together to talk a little bit about what do we need to do in response to the COVID-19 pandemic. So what started out as virtual meetings has now grown to become a movement, and I'm excited to share more about Women Leaders in Eye Health, which is a collaboration between Orbis International, Women in Ophthalmology, and SEVA Foundation, and hopefully more to join too. So Women Leaders in Eye Health is a pioneering collective initiative that seeks to uplift women at every level in the eye care space. We're doing this through transformative leadership, support with mentorship, strengthening our global networks, and helping to really break down those barriers that I just talked about and find the solutions collectively on how to address them. And we're doing this because when we help women, we help everyone, right? We're promoting equitable and inclusive care for all. So at this moment, we are global in our initiative. We have incredible networks across all of our regions, and we are really looking to deepen how that support can flow to different parts of the world and in different countries as well. We have 4 core work streams that we're involved with right now. The first is around conference sponsorship. So we actually provide grants for women to go to different conferences in the world and present their own research or show up as panelists. And then we're also looking to ensure that they have platforms to share thought leadership and their own expertise. The second work stream is around what we call coffee hours, which are informal events that allow women to share and build connections with one another. We do this virtually as well as in person, and we're looking to build out this community engagement space. The third part is around training, so building out more resources when it comes to gender equity so that you all have the tools to go to your workplaces and share them with your colleagues and make change there. And last but not least is kind of focusing on how can we include gender within our own organizations as well as with our partner institutions and strengthen from the inside out and lead by example. So I'm really happy to share that in 2024 it was a huge evolution, and we were able to do quite a number of exciting things for the first time. We were able to provide our Cash Assistant Awards. We hosted 6 coffee hours at some major conferences. We also completed a training survey to look at the unique topics that our different country offices asked for when it comes to providing training support in the future. We were so pleased to launch our Women Leaders in Eye Health Advisory Council, which Madame is part of, which is such an honor. And now we're looking to deepen our research efforts as well and looking at a survey that I'll talk about in a moment to really understand how can we provide solutions to the challenges that women face. I just want to share a quick example of Dr. Benegas, who's from Honduras, who was able to go to a conference last year. And it really transformed her career. It really showed that she can produce her own research, she can be seen in different spaces as a leader, and bring that knowledge that she has from gaining that experience back home and integrate that directly into the work she does every day. So there's many ways to join and get involved with Women Leaders in Eye Health. We're so happy to have everyone who's interested reach out and be in touch. These are just some of the ideas that we have for the general public, but there's probably more ways that we can collaborate. The first also was a research survey that we are doing right now that we want to collect as many responses from you and your colleagues around the barriers and the solutions that are needed to support women to thrive in leadership. So last but not least, I'm so grateful to be here with you all. Thank you for your time. And this is another QR code to have you join our e-newsletter to stay in touch. Thank you so much.
Yes. Dr. Madhu, any comments?
No, she's actually opened she opened actually a new avenue which can be truly utilized by WAS members. And also she's showed us this thing QR code for a survey. So those who have not taken a survey can take a survey. See, Orbis as an organization is an international organization, and gender equity is part of their things, other than doing child programs and the flying hospital that they had. So we are doing a child program with them, but gender equity is a very important area of sensitivity. Mr. Hudke had also come here. He came to our hospital actually. So with that, in this thing that they're very aligned to. So through WAS, you can connect with TIMBO. And if there are any areas where you can be helped, so say to attend a leadership conference, or maybe you present something leadership conference, or some gender equity ideas which are inclusive, it's open for. Am I okay?
Yes,
I'm offering on your behalf.
I appreciate it so much.
Great.